Good morning, everyone, and welcome to Cosmetic Courses webinar. First of all, I would like with some in-house keeping rules. So please keep your microphones on mute, and if you have any questions, please type them, and I will answer them at the end of the webinar. Also, I will ask you, please don't record any content, and as that is a property of Cosmetic Courses and my personal as well. Let me introduce myself. My name is Dr. Olha Vorodyukhina, and I'm a dentist with 15 years of experience in dentistry and almost 9 years experience in facial aesthetics. Today's webinar is specifically dedicated to dental professionals, dentists who would like to start their career in facial aesthetics or possibly already practicing and looking what other options available for them, how to make themselves busy in aesthetic, how to build a successful aesthetic practice. So I will share with you my personal experience. We will look at different options, what is available training-wise for dentists, practice-wise for dentists, and we will look at some cases as well. My experience with facial aesthetics started 9 years ago when I attended a training course. It probably was slightly different to how most people do. Many dentists start their career in aesthetic with injectable treatments such as toxin and filler. My journey started with learning about skin and skin health. So very first courses that I have attended, it was derma roller, a skincare range, a budget training, skin peels, and then later on in 2013, I have moved on into injectable treatments, and I have already had certain patients who were interested in having this treatment because they have received a skin treatments with myself. So literally after the course, I have had a busy clinic booked in. I always was very passionate about aesthetic, beauty, skin health. So I wanted to get as much experience as I can. So for 1 year, I worked for a company called New Cosmetic, where I have gained a lot of experience by seeing a high number of patients. And at present time, I practice aesthetic full time, I can say. I still practicing dentistry. I work as a dentist 1 day a week because I don't feel that I want to leave my dental profession completely. And I believe is my dental degree, my dental knowledge that allowed me to succeed in aesthetic medicine. So I really enjoy dentistry, but I enjoy my present balance, working 4 days in aesthetics and 1 day in dentistry. But the truth is, with having your own business, you're possibly working 7 days a week. So what is my perception of facial aesthetics? For me, facial aesthetic always was my passion. Then later on, it became a lifestyle, and I have been able to build a successful career based on that. I strongly believe that if you do something with passion and you truly enjoy it, you will succeed and money will come. I also probably have been in a very fortunate position when I started in aesthetic. Money has never been my driven point. My driven point always were I wanted to get the best result for my patient. I was absolutely amazed with what we can deliver and achieve with non-surgical options. And I always have been very eager to learn and learn more, and I still remain the same. Aesthetic medicine is growing quite dramatically, and this is a chart that shows you the growth and also the value of overall beauty sector. And if we will compare this to the dental sector, beauty sector overtake dentistry significantly, and it also continued to grow. And at the moment, we are actually in the situation where we can't see patient face to face, and it is specifically probably affecting dentistry the most. I would say, of course, it's affecting aesthetic business, it's affecting beauty business. But what I have noticed over the last 4 or 5 weeks since the clinics has been closed, it's actually, sorry, from the mid of March, our skincare have increased dramatically, and we have much more interest in people investing into their skin health, which actually work quite close with the beauty sector, not just aesthetic sector alone. So what makes actually a successful aesthetic practitioner? Everyone talks about 3 A's of success: ability, affordability, and basically it's your ability that will drive patient and bring patient to your practice. I would say at the beginning of your career, especially if you're a single practitioner, if you're a dentist who, the only dentist who offering this treatment in your dental practice, it is your ability that will bring the patient to your doorstep. Availability, when you will build your reputation, patient will come to you. Sorry, I moved to the next slide. When you will build your reputation, patient will come to you and they will wait for you, and they will not betray you, they will not go to anywhere else. But at the beginning, you need to be flexible and available for them because they don't know your ability yet. So demonstrate your ability first, be available, and then your patient will be waiting for you. And affordability. With affordability, I mean not cheap treatment. Cheap and affordable is a completely different thing. So by affordability, to me, affordability means value for the money. And that is where we need to give our patient the best possible experience they can have when they come to see us for treatment. Because aesthetic treatments are a luxury, but nowadays I think they become more and more norm. And when I started, I could compare how the market have changed. I think when I have started in 2011, 13, less patient wanted to have the treatment, less practitioner offering them. And I think even if you would consider price £200-300 for treatment, it was considered quite a lot. I think today £200-300 for treatment is not a lot at all. And most of our patients, when we will come to discuss some cases, pay considerably higher amount of money to achieve the result that we can deliver with non-surgical option. But it's about experience that we can give them during this treatment. And this will come to the multiple combination. So it's not just treatment itself, it's their experience when they, from the moment when they arrive, how the phone has been answered, what the aftercare they have received, and can they come to you if there is any problem happens after the treatment. So make sure that they have the best possible experience, and then literally you can charge and increase your prices. So could facial aesthetic be the right move for you? I would say if you're a dentist, I would say my recommendation will be is absolutely yes, especially if you're interested. And I believe if you're watching webinar today, you're definitely interested in facial aesthetic. I'm a strong advocate that dentists are made very, very good and skillful aesthetic practitioners. So aesthetics is very close to dentistry. If we would think about modern dentistry and of what patients want today, people more interested in cosmetic treatments such as whitening, smile design, composite bonding, adult orthodontic treatment. Aesthetics is hand by hand with those treatments. So because what actually happens, we have, as a dentist, restore inside the mouth. We gave them a beautiful smile, but yet something still can be missing. So, and that could be a perioral fine lines, they could have a downturn oral commissure. So we still may not receive this full satisfaction of the result if we wouldn't address area outside of patient mouth. And dentists are very, very skillful. During our training, we learn about maxillofacial surgery. Face and neck anatomy is actually our bread and butter. That is what we learn in university and concentrate on those areas the most. During our dental training experience, we have opportunity to deal with traumatic injuries, suturing, and assessing facial symmetry as a part of complex dental treatment. That is all complement your knowledge and already give you a competitive advantage in comparison to other medical professionals who start in medical aesthetics. So also another huge plus to be a dentist, that most dentists who work in the dental practice or in the hospital, they actually perform a technical procedure on a daily basis. So we inject patient, we treat their teeth, we remove their teeth, we build up fillings, we do cosmetic dentistry, so it's all manual procedure, which made us quite good with actual injection. And another big advantage is a business skill. Very few dentists who are employed, that is only dentists who work in the hospitals, but general practitioners, they all self-employed. They either business owners or associate dentists, and they have a certain business skills to be able to work either as a self-employed or a principal dentist. So this gives another competitive advantage towards dentist. Dental surgery, in my opinion, is absolutely fantastic environment to perform cosmetic procedure. We have a fully functioning chair, excellent light, our cross-infection control spot on, we're registered with the CQC. And that is a very interesting point, guys, about CQC, because now if you perform advanced aesthetic procedures such as a PDO thread, you actually need to be CQC registered. And that is a good things that recently have happened in aesthetic. I hope that it will be a requirement for more regulation coming up, and other procedure will be also regulated. So, but other procedures such as injectables and skin treatments, they're not CQC regulated, but it's always nice to demonstrate to our patient that we are a step ahead and we're doing better than other people. And another huge plus is actually already existing client base, our patient base who come into the dental practice. So your advertisement can be very straightforward, but it also need to be very smart. What I have been observing, I know many dentists who work in dental practices, but they're not as busy with facial aesthetic there. And on the other hand, I know many dentists who were able to make it exactly right and work for them, and they very, very successful and busier with facial aesthetic in their dental practices than with actual dentistry. The advertisement need to be quite clever, so you need to think about your marketing strategy, but it can be very, very affordable in comparison to other practitioners who don't have existing patient to advertise to. And business skills, from business point of view, it is much easier to implement new service into existing business rather than to start a business from scratch. I will give you a very practical example. If you're a principal dentist or if you're associate dentist and you decided to offer facial aesthetic, you already have staff in place, you just need to provide training for them, you have a premises, you have a patients who you can send a newsletter, organize an open evening. And in comparison, if a hospital doctor will be coming to open a clinic, they need to think about where they're going to be practicing, who will be answering their phone calls, and to who they're actually going to be advertising, because offering this to the patient that you see in the hospital is not very appropriate. How facial aesthetic can benefit your practice? So always look beyond patient mouth. And if we met with you already, if you came to one of our training days, you might heard that I always say this to our delegates. When we treat patient, I always say to them, look inside patient mouth, because a lot of dental problems, position of the teeth, could affect the treatment outcome. So today I'm actually saying look beyond patient mouth. So what actually a facial aesthetic, how it can benefit you personally. So it demonstrates that you will offer more progressive dentistry, so you will offer to your patient better care. You will be able to achieve greater results for the patient who you're offering smile design, because you will be able to complement your smile designs with other treatments such as probably enhancement and rejuvenation of perioral area. You will increase your private treatments revenue. It's a good skill to have on your CV, and of course it will generate you additional income. Like with anything, it is important to plan, and plan before you take any action. So decide what you would like to achieve with the facial aesthetics. Are you quite passionate about cosmetic dentistry and you want to extend your skills? Are you looking for an extra income? Are you going to do it part-time or full-time? And you might start at the big advantage of aesthetic. It might be a part-time job, but you can easily make yourself busier as you're receiving more training, as you're more enjoying it, and maybe some change in personal circumstances. I can share with you my journey. So when I first started, I did, like most people, just a little bit aesthetics. I was offering it in a dental practice where I have been working as an associate dentist. I was renting a room in one of their quite high-end beauty salons. When I seriously decided that I want to make it work as a business rather than as a hobby, and that decision I made after a year practicing injectable treatments. Within 2 years, I built a successful clinic, independently earned, which is a freehold, a 2-story building, and we're quite busy, and we have a second clinic now, so you can grow at your own pace and make yourself as busy as you want to be. How facial aesthetic actually complement dentistry, and why it's not just about the look, but it's about the function, it's about the health. So some cosmetic treatments actually work better than dental treatment. For example, based on my personal experience, bruxism is a condition that's not always successful with treatment of different dental appliances. Patient not always compliant, it's not always effective, but it can be successfully treated with a toxin injection. Treatment of the gummy smile, gingival dysplasia, is very effective with the toxin injection, and also lip augmentation can be a great complementary treatment to the smile design that you're offering to your patients. Let's have a look just at the potential income, and you can make your own decisions and conclusion based on that. So I took the most popular treatment in dentistry, in cosmetic dentistry, and the most popular treatment in facial aesthetics. So if we will have a look at the injectable treatments such as Botox, it takes to administer it properly about 20 to 30 minutes, but you might want to give your patient like an experience as well. So to actually perform the injection probably when you build your skills and you are confident wouldn't take you no longer than 5-10 minutes. But you want to make sure your consultation is thorough, your patient is happy. Some patient might want a topical cream. So you potentially can perform 2 Botox procedures an hour, and it gives you approximate profit per hour between £300 to £500, depends on the area where you're practicing. Derma fillers can actually, with derma fillers, I would say there is actually no limit, because you can perform non-surgical facelift with life-changing procedures to the patient, and it's required to use of multiple product. So the cost of what is demonstrated on this slide could be considerably higher. But let's say if we start with basic, on average, you can look again at an hourly rate, £200 to £700 an hour. In comparison to this, you can have a look at the cosmetic dental work. Obviously, if you will compare it with an hourly revenue, it is slightly less. But again, it depends what type of dentistry you're practicing. It's just a guide, guys. So returning customers is absolute key to a successful aesthetic practitioner, to build a successful aesthetic clinic. And the beauty about this, we don't need a high number of customers. What we need a quality customers, and that is our patient who are trust you, who are compliant with your advice, who want to look good. And most people, when they see a result of good cosmetic work, it's becoming addictive in a way. If you go to a gym and if you build up the shape and if you're in a good shape, you feel good. Same applies to cosmetic medicine. It's like a face gym. Once you look good, you don't want to go back to look not so good. Once we fix your tiredness, sadness, but once we fixed your eye bags, you don't want to go back to the stage where you originally came. So most people would want to maintain it. And this treatment, they don't last forever. They wear off, but the more regular we have them, the least often we need to have those treatments as well. So a big advantage is that patient will be coming back probably 3-4 times a year to have treatments with you. And on average, in a aesthetic clinic, patient spends £1,000 plus. So we took as an average £1,500. Some people spend slightly less, some people spend a little bit more. So potentially, if you have 100 regular patients, and on this slide is demonstrated as a 50, you can generate a revenue of £75,000. But keep in mind, you need to make sure that those 50 patients coming back regularly to you. And there is a certain advice to that as well. We have certain tips that we can give you, how you can make sure that your patient actually comes back to you religiously and don't go anywhere else or don't miss their appointments or trying to put them for a little bit longer. In order to be a successful practitioner, appropriate training is required. If you want to be a good dentist, you need to have a good training. If you want to be an good aesthetic practitioner, again, you need to have a good training. It will make you a safe practitioner. You want to be confident at what you do. You don't want patients to come to you and have actually more education and knowledge about certain treatments and how they work than we do. And nowadays, patient education is huge. It's so much available to our patients, and aesthetic world changing dramatically, and it's moving very, very fast. So staying up to date is a key. It doesn't mean when you have completed your training that your learning stop there. Never stop learning. That is what would be my advice. And also, it is important for your personal safety and insurance purposes as well. There's available training options. Training in aesthetic have changed as well. When I have started my aesthetic journey, most training was available through multiple courses, like day courses where you attend a training, you learn certain skills, then you can attend another day of training, learn another skills. And this training is still present, and I think it is a good way of learning. I think it gives you an opportunity to learn certain skills, go apply it to the practice, then you come back, learn more, and go back to your patients and bring this new treatment to them. So it still works, and I think it's a very good option, but you need to make sure that you're receiving a training from the good quality training providers too. You also have option today to receive a master degree in aesthetic, or also to complete a level 7 qualification. So level 7, it's a year degree, and it gives you a fundamental knowledge and a very, very confident start in aesthetic. So if I would be doing my training today in aesthetic medicine, I would definitely go for level 7. Also, you need to make sure that your training provider offer ongoing support, mentoring option, because aesthetic medicine, as much as it's becoming more a great community and practitioner happy to share their knowledge, there is a lot of groups on social media, it still can be quite, you can still sometimes feel quite lonely, and you not always will have someone next door to ask a question. So make sure that your training provider can offer you this support. You also need to make sure that you maintain your CPDs, because if you're practicing aesthetic, you need to make sure that all your knowledge is up to date. So a little bit more information about level 7 qualification. So this is the most standardized learning framework, and it is accredited training. It's also gives you a registration with the Joint Council of Cosmetic Practitioner on the completion of this qualification. It composed of 8 modules, which some of those modules a lot of those modules are practical. You will receive a bespoke practical session, observation session, mentoring. You receive a 277 hours of learning, and at the end you will have an exam, and on successful completion you will receive your qualification. Many people ask, is a level 7 is a mandatory training? It is not at the moment, but it's a good qualification to have, and it might be the time where the regulation will change and it will become mandatory. How to select your training provider? So you need to do your research. Like a lot of people offering not very good cosmetic treatment, and equal amount of people are offering not very good cosmetic training. So a lot of, unfortunately, non-medically qualified people offering the training, people who have very little experience offering training. And down to me, I would say I would always want to learn from someone who actually have this practical experience, because aesthetic medicine is a practical discipline. In comparison, you always would want to learn composite bonding from someone like Didier Dici, who show great cases, who still practice in dentistry. You wouldn't want to learn it from someone who just completed the course themselves. So same applying with aesthetic medicine. You need to make sure that provider is reputable. Find out who their director, how long they have been established, who are their trainers. You might want to look at some previous delegates' feedback. Is the practical session available during those training? What is the support available after your training? Do they meet your individual needs? And also, what is quite important, delegate ratio per trainer. You don't want to book on the course where there is too many delegates and you will not get enough attention and you will left the course feeling that a lot of your questions still need to be answered. And actually where the training takes place, I would like to highlight that all training at Cosmetic Courses are in the clinical environment. Our training center in Nottingham is CQC registered, same is the main training center in Princess Risborough is CQC registered. So you want to make sure that you have completed professional training, not somewhere in not very clinical environment. So Cosmetic Courses has been established in 2002 by a renowned plastic surgeon, Mr. Adrian Richard, and we have trained, actually this number need to be updated, over 7,000 delegates, and offer a wide range of courses. Program can be tailored to your individual needs and you will receive an ongoing support. A big advantage, we offer our training in a very small groups. The maximum ratio is 4 delegates per trainer, but most of the time we have small groups, 4 or 3 delegates per one trainer, and we offer many one-to-one bespoke training session that is either for beginners or for more advanced practitioner, where you would just tell us which area you want to concentrate on, and we can offer you this support with practical experience on real patients. So what is the journey into aesthetic medicine? So first of all, we recommend a complete foundation course with a well-established reputable company. And I still think that is probably the best way, because after foundation course, if you decided aesthetic medicine is definitely for me, I would like to explore it further, I want to build my skills. So what will happen? You can then choose the road and join level 7 qualification, and the cost of the foundation course will be taken off your level 7, and you will be still able to receive this fundamental start in your aesthetic journey, or you can attend a multiple courses after that. If you decided to do foundation course and practice aesthetic for the basic skills, you can practice with your real patient. However, what we recommend, the step number 2 would be, is to do a one-to-one training. That is where you can build your confidence and where you have a trainer for yourself. Usually it's either half or full day, and you will practice on between 4 to 6 real patients, and you will be treating them all yourselves. After that, most people have enough confidence and they will go and treat their patient in clinic, and then they will come back to learn more advanced technique, again on injectables such as the toxin and filler. And after that, you can expand your portfolio of treatments, look at the skin courses, which I would highly recommend if you're practicing aesthetic. The way how I see at the moment aesthetic medicine changing, people interested more in skin health, people happy to invest in good quality skincare product, and they want to have a regular skin treatments as well. So, and then you can expand your knowledge into more advanced and specific areas such as thread lift, PDO thread lift, non-surgical facelift, sclerotherapy, non-surgical rhinoplasty, 8-point facelift, and bespoke advanced practitioner masterclass. So you can have a look at training, at this training as well. So what is your option after completing the training? So after completing the training, you have multiple options of how you can practice. You can practice at your own dental practice. You can also advantage of that we already discussed, so you don't have a huge amount of investment at the beginning. You have already established patient base. Disadvantage is if you're busy, working in a busy dental practice, you might have limited hours available. You also need to train all your team, and in some cases, it might be lack of the marketing available as well. You can work in a aesthetic clinic. Advantage of working in a aesthetic clinic is that you will receive a great experience, because that is a lot of patients, when they look for cosmetic treatments, they usually will be looking for a cosmetic treatment, cosmetic clinic who's specializing in those treatments. So you will get your experience quite quickly. Disadvantage is patient not yours. They belong to the clinic, and some clinics will take quite high commissions. You can find ways to work in other clinics, such as renting rooms somewhere, work in collaboration with some beauty salons. So you can also get quite large number of bookings, but you will be relying on other people to promote you, because you will not be 100% there. And environment is also not always ideal, so it will be your responsibility to arrange the room where you see your patient to be following with all the regulation and standards that require. So we talked earlier about ability, and this coming down to your knowledge, experience, injection technique, knowledge of the product, managing patient expectation, and have a good treatment plan for your patient. Availability, patient want time and day that suits them, and that is applies to the new patient. You need to be available for review appointments, and you will need to be available for reassurance and emergency. So at the beginning of your journey, you might feel that you're actually kind of more running after patients, but trust me, this will change. And when you build your reputation, patient will be happy to wait for you. And affordability, so patients will pay your price if your 2 A's met first. So a cheap price attracts certain category of patients, so make sure that you position yourself correct and you market yourself with a good price. Let's have a look at the facial assessment. So we have one question, just a second. Katerina, thank you for your question. So we have received a question from Katerina saying, what is my favorite treatment and why? So I will answer this question live for everyone. So my favorite treatment is actually derma filler treatments, and I also quite like PDO. Everything that allows me to look at the patient face in general and to change to achieve the results that will have impact on the whole look and face. I don't like to look at the individual areas, and in the later slides, I have some of my cases which demonstrate this. I believe fillers and threads and combination of those, they give you a lot of flexibility as a practitioner. You can improve patient face. It's actually a life-changing treatment to patient, and it's very, very satisfactory for the practitioner to see a result as well. And you see this instant result, and it's just absolutely amazing. So those two treatments are my favorite to perform. And I would say in my clinic, when we open, fillers we perform on daily basis. Guys, we have some more 3 questions, which I will have a chance to look after we go through some slides, but I promise I will answer them all before we finish this webinar. So facial assessment, age, skin and condition. We spoke about importance of the skin, so it is very important to assess this, and as well as educate your patient, explain to them what's happening to their skin and why. Facial symmetry, most of us are not symmetrical, and that is very important to assess and understand. And it is very difficult to achieve 100% symmetry with the treatments as well. So you need to point at all those areas that you see where patient is symmetrical that before the treatment, because if you do it after the treatment, it will be probably more your responsibility, rather than if you will point it before you actually started performing the treatment. And the truth is that the more symmetrical we are, the more attractive and other people perceive us as more attractive. So symmetry is important, and when we perform cosmetic treatment, we're trying to follow and achieve as much symmetry as we can. Facial proportion, so assess upper, middle and lower third of the face, and that is where you will be observing different age-related changes in the patient, and that is how you will formulate your treatment plan. So you will decide where you will start, what is the second area that you're going to treat. So create a journey for your patient, don't just concentrate on one area. And triangle of beauty, so that is this V shape that we're all talking about in aesthetics. When we're young, our face is nice, lifted, everything's lifted upwards. As we're getting older, this change, and our triangle of beauty reverse. And our duty as an aesthetic doctor, as a knowledgeable, competent aesthetic practitioner, is to know what causing these changes, how to change them naturally, or even better, to prevent them from happening. But this will be depends on which stage patient have came to us. Building relation with your patient starts with their education as well. So please explain to your patient what actually happens beyond their skin. This slide that I actually show to my patient in clinic. So when they come and they're concerned about nasolabial fold or tired eyes or not firm jawline or saggy nostrils, they need to understand why this is happening, because we're treating the cause and not the actual fact. So what we see is the fact that this actually the cause, loss of volume, muscle hyperactivity and weakening of our ligaments. And you will be surprised that with some patients it's actually can happen quite early. And more patients come to our clinics now at early age because they want to prevent this. How aesthetic medicine have changed over years as well. 10 years ago, most people have been looking at the line, and it was calling line chasing. Like we look at nasolabial fold, we feel it, and everyone thought that it was an amazing result. However, it didn't give a full satisfaction or full effect on the face. So today we're looking more at the emotional messages of the face, and that is when we teach you applying MD codes into practice. That is innovative Brazilian plastic surgeon Mauricio de Maio who invented those codes, and it is a new move in aesthetic, and on the other hand, there was an anatomical name just for those areas. Now we're applying codes, so I think for the learning perspective, it makes it much, much easier. So it's a huge advantage to their educational program. But basically also we make sure that we not just change the problem on patient face, but we actually change the emotional attribute. Like most patients would, when they present to our clinic, they would look tired, saggy, sad, angry. And when we're trying to treat them, we want to deliver them a result such as look less tired, be less sad, look more attractive, look younger, look slimmer, look more feminine, look more masculine. And there is quite a big learning curve to that. And I have been on the training program with Mauricio De Maio for last 4 years. And I would say it's definitely have changed my practice in much more positive way. So complement your dental skills. That is just actually, guys, before we move to the clinical cases, I will look at the questions and I will try to answer them now. Can I treat my own dental patients? We have a question. I will answer this question live. Absolutely, you can treat your own dental patients. You just need to open this conversation. And in order to open this conversation, I think time and place is the key. You need to be with aesthetic medicine. It is quite sensitive area. So how you bring it to your patient, because most of us thinking, well, we don't want to affect patient by making them feel uncomfortable, but there is a certain way and consultation technique where you can, in a very polite and complimentary manner, offer those treatment to your patient. And make sure if you're planning to do so with your dental patient, plan ahead, make sure that you know your patient well, and also that you ask reception allocate enough time, because when you open this conversation, sometimes this conversation takes time and you don't want to rush your patients, because you want to make sure that they trust you, and if they're interested in the subject, you don't want to cut it short. Another question we have: do you think is a good idea start with skincare courses instead of foundation, such as peeling? Again, I'm going to answer this question live. That is a very good idea. I'm not sure if you have joined our webinar slightly later, but at the beginning I mentioned my aesthetic journey have started with the skincare courses. So I was trained in skin peels, in Abaji's medical grade skincare, in microneedling, before I moved into injectables. By offering skin treatments, you will attract probably different types of patient, but eventually you can offer them injectable treatments when you're ready to offer this in the clinic as well. And skin treatments becoming more and more popular. So again, the answer to this question is yes, you can start your journey with the skin treatments. Would you advise to follow the Cosmetic Courses timeline of courses? Sorry, I not completely understand this question. So if you can rephrase it, that would be great. Like, would you advise to follow Cosmetic Courses timelines of courses? So if you mean by that in Cosmetic Courses, we recommend that start with foundation, then move to intermediate and then advanced courses, I would definitely recommend, yes, please follow that. Oh yes, that is exactly what you mean. Absolutely, I wouldn't recommend that you start your training from advanced, because we need to start from basic. That is, I think, a key to any learning. You don't implement the harder and more complex treatments first and then go back to basic. And I know some training providers, they offer foundation training and then they follow with advanced training straight away. I think it is important to offer a full package to your patient, there is no doubt. But in order to implement everything into practice safely and correctly, you need probably to make sure that you do the first steps correct. And when you're confident and competent, then you can move to the next level. Mainly that is in the interest of the trainees, because it means that you invest money in your knowledge and then you can implement this knowledge into practice and get a return on your investment. Next slide is we'll look at some dental treatments. So that is a treatment of bruxism. So this lady, and I will go, when I'll go through the cases, I will give you some, on some slides, I will go into details explaining what treatment has been done, how much time this treatment took to administer, and what is the cost of the treatment as well. Again, guys, that is a guide and everyone is different. What takes one practitioner to do in an hour could take other practitioner to do 2 hours or 30 minutes, and everyone have a different prices, but that is me just sharing with you my personal experience. All those clinical cases are my personal clinical cases, so I kindly will remind you again and ask you not to take any photographs. And I'm very grateful to my patient who happy and agree for me to share their journeys with others. So this lady we treated for bruxism. So she clenched her teeth, and also she is Chinese origin. So, and a lot of Chinese patients, they have kind of more round face that they aim to slim. So we carry on a toxin injection on her masseter muscle, and she was quite happy with the achieved result. So another case is this lady also received a treatment of the toxin injection in the masseter muscle, and also hyaluronic acid filler for chin contouring and augmentation. And volume-wise, in her case, we made just a very, very minor enhancement, so we used 1 ml. This case is a lady who has class 2 dental occlusion. So she have received mid-face contouring, low-face contouring, which has included her chin and jawline, and lip augmentation. And in her case, we used hyaluronic acid-based filler alone. The total volume has been used is 7 ml, that is 7 mils, 7 syringes. The treatment time was 1 hour, and the treatment cost is £1,740. Now, in terms of the volume of products, when we're talking about full face may sound like quite high for a lot of attendees of this webinar today. However, I can reassure you guys that we need to have a certain volume to achieve the result. When we teach you, we always recommend you less is more, and less is more is in the practice. But you need to have a certain amount to be able to achieve result. And some patients come to us with certain changes that has been happening for many, many years, because our changes to our face starts to happen as early as 25. and we might have these young girls presented to our clinic, age 27 and 28, and some people would think, oh, it's a little bit too early to treat, but the girl already looked tired. She already have dark circles under the eyes. And no matter how well she sleeps, she still looks tired. So some people have genetic related problems. So the earlier we treat, the better it is. We're preventing something from getting worse. But the later we treat, the more expensive it becomes to the patient, because we need some volume to achieve a result. And what sounded probably to me like quite a lot 8 years ago, today is absolute norm. But I would understand that if you're just beginning your journey in aesthetic medicine, I want to highlight, you need to receive appropriate training before you will start to apply a higher volume for your treatments. So another case is that is a treatment of gingival dysplasia. This is a very, very straightforward treatment. What patient have, she has a hyperactive muscle, which is levator labii superior ala nasi. A very simple treatment, just injection of the toxin into this muscle. And here is a result in 2 weeks' time. This is procedures that literally just would take 10 minutes, but of course you would book a patient for at least 30 minutes appointment, and it is at a very, very affordable cost. Another case, so this lady have a class 3 dental occlusion, which for female patient is not always very favorable relation of the jaw, and it's make her nasally bit. So what treatment we perform for her is lip augmentation to change relation of nasolabial angle, and overall it have changed her profile picture. So we treated her both upper and lower lip, regardless of the clinical situation. I always would, if we perform any lip augmentation, I would recommend to address both upper and lower lip and keep them balanced. It is very, very important. So the total volume of product has been used, in this case, 1 ml. Some examples of full face approach. So this patient of mine, so we treated her mid-face and we treated her chin as well. So we did cheek and chin contouring. And a total volume has been used in her case is 5 ml, and the treatment took 1 hour. The treatment in around her chin has been performed with the Juvederm Valax, and we were able to achieve a nice improvement. So this is a very interesting case. So this lady presented to me in 2019, and she has had a Bell's palsy. You will see it's more obvious on the side profile picture, because one side of her face is age different to the other. So the left side, there was her skin looked acceptable. There is some age-related changes, but that is not her main concern. Her main concern was right side of her face. And that actually demonstrates that basically Bell's palsy affected the neurotic system of her face. So, and the side that has been affected and less mobile, it's aged better than the other side of the face, and it's demonstrated by the fact of the volume loss as well as the changes in the skin. So she has a more noticeable volume loss on the right side, and she has a quite advanced skin elastosis. So her treatment plan included 7 ml, predominantly right side of the face were treated, but we also addressed her left side, but just with the minor changes. Uh, what is important about cosmetic treatments is that as we're getting older, we looking younger. So when patients come to us, if they come at the right time, we're not only able to make them look better, but we actually can make them to look younger. So this lady, so she's a regular patient of mine. She received numerous treatments through the years, and she has her regular skin regime. So her regular regimes include injectables, fillers, injectable toxin, and injectable skin booster, or what we refer to injectable moisturizers. So she have had a hyaluronic acid fillers, she have had a toxin injection, and she have had a profiler treatment. And she comes 3-4 times a year, and we discuss which area at the time we need to address, and we're following her routine together. Another example of treatment, so this is a mid-face rejuvenation. So this lady has been treated with a hyaluronic acid-based filler, and we replace volume in her cheeks, which gave her a nice effect on the jawline and overall made her look much fresher. And also we have addressed her temples. So in this case, the total volume has been used, just a second. So total volume used is 4 ml. So another example of full face approach. So this lady came to me before her 40th birthday, and she wanted to look fresher, and she wanted to hear my advice. But when we started consultation, she said, I will be happy with anything you recommend, but one treatment I would never consider is my lips. But by the time when we addressed her whole face, her lips looked imbalanced, and she kindly agreed and wanted to treat them, so we ended up treating her lips. So the treatment was performed, in this case we treated mid-face area, so we replaced volume in the mid-face, addressing her cheeks. We have not treated her nasolabial fold. We addressed jawline and chin area, and we addressed her lips as well, and she have had 3 areas of the toxin treatment. So another patient of mine, this lady I would classify as hugely complex. So she has a heavy, so her face looked heavy, she has a heavy eyelid, she looked tired, she have never had cosmetic treatment in the past. So it would be a quite challenging case to treat. I was debating what would be the best option for her, filler or threads, but we decided to go with the filler treatment and a toxin. So in her case, her treatment has been performed over a couple visits, and the total amount of products that has been used is 14 ml of, so 14 mils of hyaluronic acid based filler plus 3 areas of the toxin, and that is her result. Very important to check face in animation as well. So, and that is important to keep a good record of your photographs, and photography skills is also something that I would recommend for aesthetic practitioner to learn, but some dentists already have a good skills of photography. So another patient of mine, and that treatment has been performed with hyaluronic acid based filler alone, and that is probably answering the question that I previously have had, what is my favorite treatment? So these treatments are my favorite treatments to perform, where I can see the difference, where I can make a difference to my patient, because the difference that I made, it's not only to their faces, it's to their life, it's to their perception of themselves. They become more confident, they become more positive, they enjoy life more, and they're much more happier in themselves. So this lady have had again, full face approach. We address temples, mid face, tear trough, jaw, chin, and perioral area. And the total volume in this case has been used 12 ml. So examples of lip fillers. So this case demonstrates lip augmentation with using 2 ml of hyaluronic acid based filler, and immediately after the treatment with minimal swelling, and then with when the lips have settled down, this treatment has been performed with the cannula. Another example of treatment of the lips with the cannula, where 1 ml hyaluronic acid-based filler has been used. PDO threads, so that is an example of before and after. This patient is actually have been treated by one of the doctors who has been to who I was a mentor. So she came to our clinic with, and that is her mom, with her mom, and she wanted to build more confidence before she performed treatment on the patient independently. So we treated her mom, and this treatment was performed under my supervision. And this is my case. So PDO is quite effective procedure for people who want to achieve a lift or slimmen their face. So regulatory bodies for aesthetic doctors are Safe Face. If you are a dentist, it's a General Dental Council, CQC, Treatment You Can Trust, your own regulator. Take home points from today: create achievable business plan. If you're practicing aesthetic already, still create a business plan, because today is the time we're living in, the most odd times today. Even 3 months ago, no one could imagine that something like this, like pandemic COVID-19, could happen. So this is a beautiful opportunity for all of us to actually review our business. And if you want to change something, or you think, I wish I have done it that way, this is the great time to do it. Your first consultation is the key with the patient. Grow steadily and confidently, practice safely, invest in your training, less is more, aim for natural result. Remember, I haven't started my journey by using 12 ml on the patient. My journey started, like most practitioners, with using 1-2 ml, building it up, and then when you're confident, you can create cases where you address a full face. Continue to update your skills, stay up to date with your treatments. This is just a guide of some courses that I have done. It's not all courses, but just those fundamental courses that I have done at the beginning before I set it up as an independent practitioner. So for today, so for everyone who have attended our webinar today, you will get a 10% off of our online academy. Cosmetic Courses have adapted with time, and we have online academy where you can learn all the fundamental and key knowledge for what you will need after the lockdown will be finished, because it will be finished one day, and hopefully very, very soon. And what I'm very confident in with, that people would want to have this treatment. A lot of patients of ours, they can't wait when we reopen. We actually have a waiting list now for the clinic. Patients contact us regularly and saying when you will be open. Even patients who haven't been for a while, even patient who has been to us last time, probably 3-4 years ago, they got in touch. So aesthetic market is very, very strong. If you have any doubts about should I or should I not, I would say if you would invest and start learning now, you will be ahead of some practitioners who actually stay doubting themselves, and as well as treatments, training will be quite busy after this pandemic is over as well. So on our online academy, you can learn a foundation course, introduction to lips, cheek fillers, contouring, and complication. I hope you enjoyed the webinar. I just have 2 more questions to answer. Oh, no, I have answered them already. So thank you very much for listening, guys, and enjoy the rest of your day. Thank you very much.